So you may think you know everything when it comes to heartburn. I think I do as well, but you'd be surprised how many things I've heard from patients who thought what they thought was true, but actually ended up being not the case. In today's video, I'm going to go through the 5 most common myths I have heard when it comes to heartburn and acid reflux. I'll debunk them and give you the actual information you need to have when it comes to improving your gut health and your heartburn as well. Howdy, I'm Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic. I have over 10 years of treating patients with all sorts of heartburn issues. If you haven't already, don't forget to smash that like button, like, share, and consider subscribing so you can get more information about what's going on when it comes to your heartburn. And if you live here locally and you want to come see us up at Gastro. We can find out exactly what is going on to get you feeling better. Myth number 1, spicy foods are the enemy. Yeah, a lot of people think that having spicy foods is like the enemy, like you can't have any spicy foods. Let me tell you, maybe that's not the case. There are a lot of people in Texas, where I'm from, in Lubbock, who have a lot of spicy foods that don't have reflux, and there are plenty of people that drink water that have rip-roaring reflux. The data between having certain foods, like tomato-based foods, citrus foods, and spicy foods, and that leading to reflux actually is not really there. Just keep that on the down low, okay? I don't want other doctors to know about this, but it's actually true. Now, the real reason why you have acid reflux may not be the food, but it's the valve, the lower esophageal sphincter. That's the valve between the esophagus and reflux. This is why you have acid reflux. It's not because of food. Now, the food may make it more often for you to have that valve to be open and cause reflux symptoms. Okay, yes, that's for sure, but there's not a direct correlation between spicy foods and your reflux symptoms. So the valve, that's the enemy. The valve is the reason why you may be having reflux to things like water. Yes, water, because for some reason that water can allow that valve to open longer and more often to cause you to have reflux symptoms. So then the question becomes, can any foods cause acid reflux? And the answer is yes. So I'll give you my example. I can have coffee, not a big deal. I'm fine with that. But if I have beef, even a little bit of beef, I have terrible acid reflux. So my best advice for you is to use your body, use yourself as a guide to find out exactly what are your triggers and what are not your triggers. Myth number 2, heartburn is just a nuisance. This is absolutely a myth. Let me tell you a story. I had a patient that was 35 years old, had intermittent reflux, didn't think it was a big deal, had a little bit of thought it was a nuisance, not a big problem. So his reflux was getting a little bit worse. He wanted to kind of make sure everything's doing okay. I did an upper endoscopy, and guess what I found? We found esophageal cancer. And this is so sad to have a 35-year-old person who was just having reflux, just as a nuisance, ended up having cancer. So the biggest risk factor when it comes to esophageal cancer is acid reflux. And it's not acid reflux that's rip-roaring, that's terrible. It's acid reflux that's intermittent, that comes and goes, but it's chronic in nature, and that chronic inflammation over time will cause the cells to change in the esophagus to lead to esophageal cancer. So I need to stress to you, if you have acid reflux, the correlation of your symptoms does not correspond to how bad your reflux is, but what does correlate is how long you've had acid reflux. So if you've had acid reflux for a long time, that is a risk factor for you to develop esophageal cancer. Other warning signs that we have include trouble swallowing. So if food gets stuck, water gets stuck, that is not normal. Don't ignore that. You get full quicker and more often. You're not eating as much because you're just getting full. If you start to have black stools, that's a sign something's bleeding in the upper GI tract that needs to get investigated. You have severe pain in this area that's not getting better with traditional treatments that needs to get investigated. But by far, the biggest risk factor for cancer is long-standing acid reflux. Myth number 3, milk to the rescue. A lot of people have told me, hey, drink some milk to kind of calm things down and make things easier for your acid reflux. But that's actually not true. Milk, it may not make your reflux symptoms better, but in fact, it can actually make it worse. So if you have milk, especially the full fat milk, what that milk does, it stays in your stomach, and that fat creates more juices, and it just gets juicier and juicier with all the acid. And that milk, because of the fat, will actually also cause your lower esophageal sphincter to be open longer and more often. So instead of making your reflux symptoms better, it actually can make it worse. And then on top of that, if you have lactose intolerance on top of that, oh my goodness, you'll be having heartburn, you'll be having pain, and you'll be having gas and farting. That is a terrible combination, which I don't want you to have. So, does fat-free milk cause the same problems? I don't know. We have no studies on this, but if you want to try and see how you do, that's perfectly fine. But just know that your reflux symptoms may be getting worse. So you may be wondering, all right, Dr. Islam, now that I've eliminated milk, what can I do naturally to control my reflux? Well, there are 2 things I recommend. LGL, which is also licorice, has been shown in clinical trials to help out when it comes to acid reflux. Now, always when you want to start something like this, speak to your healthcare provider so we can make sure you're doing the right thing and you don't have any interaction that you don't need to be on. Number 2 is also alginate. Alginate is a coating that we use to help kind of coat the stomach. It's also found in Gaviscon, which is also very effective when it comes to acid reflux. So try these things out instead of trying milk. Number 4, medication is the only solution. This is absolutely a myth. Now, there are certain individuals in which you have to be on medications for your acid reflux. Absolutely. You have a history of Barrett's esophagus. You've had a cancer in the past. You take high dose steroids. You take an anti-inflammatory medication. You have a history of ulcers. The list goes on. If I have somebody who has these conditions, I'm going to tell you, you have to be on a PPI or an acid medication. I'm sorry. That's the case. But the vast majority of people, you don't have to be on an acid medication. Things that are natural that do work include lifestyle changes. The biggest lifestyle change you can make, the biggest bang for your buck by far, is weight loss. We have seen studies showing that weight loss not only can eliminate your acid reflux, but can also change the trajectory of your risk factors for developing esophageal cancer as well. So out of all the things you can do, weight loss helps. Other things help out: not eating late at night, having small frequent meals, sleeping on your left side of the bed. These simple changes will make a difference when it comes to getting your reflux taken care of. Myth number 5, once you've been prescribed an acid reflux medication, you have to be on it forever. This is absolutely 100%, well, with a few exceptions, a myth. Now, like I mentioned before, there are certain conditions in which you have to be on a PPI long-term and forever. And I talked about this in other videos. However, if you don't have these conditions, absolutely, my goal is to get you off the medication if you can. If I can treat you naturally, that's what I want to do. And so if we can incorporate lifestyle changes, if we can make changes to our diet, if we can make adjustments to how we eat, how we sleep, and how much we weigh, we can add in supplements. If I can get you off your medication, I can. But even if I can't, if I can put you on the lowest dose possible, that is what I'm going to do. And so you don't necessarily have to be on a PPI forever unless you have the conditions in which you have to be. Once again, don't make it change unless your doctor tells you. But otherwise, if we can get you off the medication or minimize it, that is our goal, especially at Lubbock Gastro. All right, guys, these are the most common myths that I have seen when it comes to acid reflux. Let me know in the comments down below, do you have a myth that you've heard about or you're wondering about when it comes to your acid reflux symptoms? Comment down below. We'll collect them. I may do a second video on this, depending on what you guys say, so I can hopefully get your symptoms taken care of for you. Well, thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to come see us at Lubbock Gastro for all your GI needs.